As I said, it's all about respecting pulp. It's all about understanding dentine, because when we talk about bonding, it's very important that you know how to bond the dentine and enamel and how to protect the pulp. So these are some things which we will discuss in detail as well. So these are dentist everyday challenges. When I talk about aesthetics, they are not happy with shade matching. They are not happy with morphology. They are not very good at layering. When it comes to adhesive, they feel the composite restoration is debonding. There is no longevity in their restorations. Sometimes finishing and polishing is always an issue, because remember, when you don't finish and polish your composite, that's when composite will fail from an aesthetic perspective. So you got to make sure you finish and polish well. And of course, when we do posterior composites, we are not very happy. Sometimes we don't get very good contour in proximally, and we don't get very tight contact. So these are some challenges which we will dissect in our presentation following the demo. Okay. So let's dissect the first variable. What's the first variable? Selection of composite. How do you select a material? Selection of material is done by two important criteria. One, what I call is a must. I need this from my material. And what is that? Compressive strength, wear resistance. I need it no matter what. And then there are certain things which I like to have in my material. These are called my nicer ones, okay? Now what are your nicer ones? Your nicer ones are all these variables. Now the problem is, every composite will not have these nicer ones. For example, dense ply will have two things. 3M might not have these two, 3M might have this. Evoclar might have only these two. Are you getting my point? So now it is for you to decide what are your nicer ones, and that becomes your selection criteria. Okay? If you ask me, my nicer ones, I need very good handling from my composite. My composite should not stick. My composite should not frustrate me when I'm placing. Okay? My composite should not slump, because if it slumps, I might get air voids. And the second important thing is polish for me. When I finish and polish my restoration, I need to get very good gloss. And more importantly, PRR. What is PRR? Polish retention rate. Okay, if you look at literature, if you look at research, if I polish a composite today, the PRR of all nano hybrid composites currently is more than 5 years. Polish retention rate, that means the polish will last for 5 years. This is PRR. Any composite where the polish is lasting only a year is not good. Now why do they last more? Because of the technology, because of the fillers in the resin. And currently what we have, let me show you. We have these two composites in the market, nano hybrids and nano filled. Nano hybrids and nano filled. We don't have these hybrids, microfill, macrofill, microhybrids. These are all older composites. So the technology is improving. When technology improves, you get very good polish, you get very good handling. So let's look at the nano hybrids and nano fill. Let me show you what technology has to offer. We don't have all this. Of course, we have nano hybrids, which is 75 to 85% by weight. Nano filled is 78 to 87% by weight. So if you look at a lot of research papers, the retention rate of nano hybrid and nano fill is close to 86 to 89%. So if you are doing 100 restorations, 89s are lasting for more than 5 years. So that's really good. Okay, so don't bother about the material. We have excellent material. You only need to focus on how to use them rightly. Okay. So what have they changed here? If you look at this new composite from Densply, Sirona, I think they might be launching it, I'm not very sure, but we use them a lot in India. It's called Neo Spectra ST. Currently what you have here is only Spectrum, what I understand, but this is the new composite which is called Neo Spectra ST. ST stands for Sphere Tech Technology, Sphere Tech. Sphere Tech means all the filler particles in this composite is like a sphere. It's like round. It's not irregular, it's regular. Whenever you have a regular filler particle, you can load more because it increases the surface area. Okay, you can load more. And how can you load more? By decreasing the size of the sphere. So you see, there is a big sphere, there is a medium sphere, and there is a small sphere, and there is a smaller sphere. That is why the filler particle ranges from 10 nanometers to 0.06 micron meters. That is why this is a typical nano hybrid composite. Since all the filler particles are like a sphere, it gives you a ball bearing effect. Every sphere will go over every sphere. Are you getting my point? So it will not stick too much. And it gives you excellent polish. Right? So, any questions with material? So it's all your comfort zone. Believe me, all materials are good in the market, but it all depends on what you want. What you want from the material. Okay? So in my opinion, I need handling, I need polish. These are the only two things I'm looking at, apart from the compressive strength and wear resistance. Okay? So I'm going to show you all the composites today in the demonstration, what we use. Now let's go to the second variable. This is very interesting. Very, very interesting. How many of you struggle with shade matching? We are talking about composites, not ceramics, okay? We are talking about composite. How many of you, this is very common. You are doing your restoration, you feel very good because you know shade is matching, and the moment you start finishing and polishing, you see now the shade becomes either a little darker or it goes a little lighter. Does that happen? Very common. Because we have never understood the science of color. For us, color was only in first year of dental school. We used to read from textbook. You remember Anusaris, Skinner's? Because we knew that this question will be asked in the exam. So we used to read and we used to write in the paper, we used to pass, and then nothing. For everybody, color means A2, nothing beyond that. Every patient we communicate A2, but nobody has understood A2. I will train your eyes. This is extremely important. If you have to be very good in color matching, if you have to train your eyes, you need to know histology. You need to know histology, because histology of tooth is responsible for color. Let's look at dentine and let's look at enamel. There are only two structures which are responsible for color. One which gives color to the tooth and one which modulates the color. Okay? Dentine is the primary substrate which gives color to the tooth. Enamel is the modulator of the color. How much you want to see dentine? If you want to see more dentine, enamel will be less. If you want to see less dentine, enamel will be more. Are you understanding? So if I am looking at this cross section, all of you can do this in your clinic. Take a central incisor, okay? Cut it in the center exactly with a disc. From the incisal edge till the root tip. And now you see the section. The section will be something like this. Now when I see this section, I can see two substrates. Am I right? Dentine, enamel. Now, what is more important? Please see the thickness of the substrate. When I am coming from the cervix, this is the cervical third, am I right? This is your pulp. That's my cervix. What's happening when I'm coming from cervix to the incisal edge? What is happening to dentine? Can anybody tell me?
The thickness is decreasing?
Absolutely. The thickness is decreasing as you're coming from the cervix to the incisal. See, this is nature. This is nature. This is exactly what you should do when you put your dentine layer, when you're doing a veneer. You can't place your layer uniformly. That's wrong. That's not acceptable. What everybody does is they place their the layer very uniform. No, you should vary your thickness when you're placing your layers. That is layering technique. When I'm looking at enamel, you see the enamel. It's quite thick at the edge. As I'm approaching the cervix, what happens? It becomes very, very thin. 0.3 millimeters. It's only 0.3 millimeters on an average. This is nature. So now you look at any patient's tooth. Usually, the cervical third of a central incisor or a canine or a lateral will always be a little dark. Have you seen that? Why? It's more chromatic. Why? Because there is more dentine, less enamel. Same, if I come down, if I see any patient's incisal edge, it is always translucent. Why? Because I have a lot of enamel, less dentine. This is exactly how you get color from the tooth. So what do you learn from this? That the final color is directly proportional to the thickness of your composite and not to A2. So you understood? For example, if I take, you can do this exercise in your clinic. Take an A2 composite, okay? Make a 2 millimeter thick disc with A2. You can take any tablets, what you get for headache. You can remove the tablet, throw the tablet in that sachet, and you have that round mold, correct, of the tablet. You pack composite in that light curate, you remove, you will get a disc. So when I do a 2 millimeter disc, when I do a 1 millimeter disc, and when I do a 0.5 millimeter disc from the same A2 composite, the final color what I see from all these three is not the same, even if the
Shade is same.
shade is same. You got my point? This is exactly what you need to understand. So if you want more chroma to be seen from A2, thickness of A2 will be more. If you want to see less chroma, thickness will be less. So how do you go about with shade in terms of patient's age? It's very simple. Please remember, categorize your patient. Your patient will either be young, adult, old. Any patient who is young, their teeth are always bright. Bright means value is high. Any patient who is old, their teeth are always dark. Value is low. Is it very clear? Anybody adult, 35, 40, they are always medium value. Is it very clear? So these are the things you need to understand.